All right. So now recording. So we'll try to get through 9 to 21 if we can. 9.
It restarted my book. That's the problem with digital book. It restarted my book.
Oh no. All right. So question 9 is hygiene. That's chapter 40. And it's nope, still not far enough. Okay. So hygiene. How a nurse applies critical thinking when providing hygiene. So,
How the nurse applies critical thinking when providing hygiene?
So you're gonna.
Is that like?
So page 919 kind of has it. It's critical. It says critical thinking. So, so you have to integrate nursing knowledge with knowledge from other disciplines. So, like, for example, a patient with diabetes mellitus has special needs for nail and foot care to prevent injury and infection. So shaving them, you have to use an electric razor instead of a razor blade, and you have to, you can't really cut and trim their toenails too deep, or you have to use a file to get it down. And then knowledge about the pathophysiology of diabetes and its potential side effects on peripheral circulation and sensory status. So like you don't feel things as much. So, and then culture, religious preferences, nursing, critical thinking. So like, is there anything that would impact or hinder them doing personal hygiene? Do they have mobility restrictions? Do they have environmental restrictions? Do they have access to water, specifically hot water, clean water? Do they have access to the resources to get the hygiene? Do they have soap, and do they have toothbrushes and toothpaste and stuff like that? Do they know how to clean properly for their specific conditions? Do they have the adaptive devices, medical equipment for what they need? So like a shower stool or extenders, or do they have somebody there at home that can help them? Think creatively to help patients adapt. This is on 920. You need to individualize patients' hygiene with an attitude of flexibility. Also, it talks about for patients with decreased activity tolerance, pace out the activities, plan rest periods, rely on professional standards for skin and foot care from specialty groups, and ethical standards when planning to meet a patient's needs. So again, that's back to the, and that's also the cultural preferences, like how often do they prefer to be bathed? Do they do everything all at once, or do they only do parts of their body? Or hair, how often do they wash their hair? Because some people do it every day, every other day. I wash my hair like twice a week. Not to say I don't wash the rest myself, but just.
I wash my hair every day because I'm a big oily mess. If I don't.
No,
I don't want to train myself a disgusting human.
I only wash my hair 2 or 3 days.
You guys are amazing. I cannot.
So I try to go every other day, but my hair is so greasy. Like sometimes I'm just like, all right, just carry on.
Well, if you just put it in a ponytail and a hairband that covers like most of your hair, you don't have to worry about it looking oily.
I don't know. It finds a way. It's still like, I swear to God, I put it back and it looks like even greasier than it did. Greasy.
It'll look like decent, and then I put it back and I'm like, holy Batman.
Okay.
But then I just get that dry shampoo with the brown in it, and it gives you an extra 2 days. I mean, you still look rough, but we all
love me some dry shampoo. Love me some dry shampoo. Here's And then go ahead.
I'm babysitting my grandkids and the dog is outside barking. So I'm sorry for that. I'll be right back.
Okay. Well, if you feel like you missed anything, this is being recorded. Okay. So also table 40.2 and 40.3 are like skin problems and risk factors. And that's where the answer for question number 10 would come in. Oral problems. So if you can't use your upper extremities very well because of paralysis or weakness or mobility, you might not be able to brush your teeth. Dehydration causes excess drying and fragility of mucosa. Gastric tubes, oxygen tubes, or if you're a mouth breather, can cause drying of the mucosa. Drugs can dry your mouth out. Lozenges, cough drops, vitamins can cause cavities because you have sugar in there. Radiation therapy to the head or neck reduces salivary flow and lowers pH. Oral surgery, immunosuppressants, diabetes, intubation, dialysis, cognitive impairment. It's very interesting because on one hand, I have a patient that I take care of who we have to put chapstick on like 3 times a day, and that's part of her plan of care is chapstick on her lips 3 times a day and to swab her mouth out to make sure that's hydrated enough. And then on the other hand, I got a guy who is so freaking drooly that we have to change his shirt because he drools on the shirt and soaks it down to the skin.
So I'm sorry to interrupt. Are we going through the blueprint for foundations?
We're going through the blueprint for foundations right now. And then we were talking about doing the blueprint tomorrow for farm a little bit maybe.
Sure.
Yeah, and then the pharmacology isn't until 1 on Tuesday. So I was like, well, we could meet after validations that we have to make up on Monday, and we could meet early in the morning on Tuesday.
Okay. So did you guys go over the study guide thing yet for farm?
We're
I
doing
looked
that
at it,
tomorrow.
but that's all I've done.
Okay, yeah. I was gonna start doing it today, but I couldn't focus. So
I think we should finish off tonight working on foundations, and then tomorrow at our first Zoom, we should work on starting farm.
Okay. Well, there's 4 of us. We could break it down. We each do 10 questions.
Yeah.
Or 20 questions. I lied. Hold on. 75. Is that 27 plus 31?
why did you eat the cat food?
But I mean, a lot of the stuff I'm not really super worried about.
I think we should go through it quick like we do this.
Okay. So, but let's get through this first. Okay. So that was question 10, discussing conditions that place patients at risk for mucous membranes, dehydration, mobility issues, cognitive issues, diabetes. Medical devices. All right, vital signs. Select nursing measures that promote heat loss and heat conservation. Vital signs is chapter 29. It's pulse. That's not right. It's too far. Heat production, heat loss.
Sorry, what chapter is vital signs?
29.
29.
Okay, thank you.
I was muted. 29. Have you guys seen New Girl?
Yeah. I love that show.
I love that show. 29.
Okay.
Measures that promote heat loss. When I was doing the EUs, it was suggesting to have the explain to the patient not to move too much, take off like the top blanket. And it discussed using the cooling blankets, but then in like a bunch of them, whenever I picked the cooling blanket, I got it wrong.
Mm-hmm.
Oh yeah, mine says nurse should. My notes on this was nurse should remove clothing and blankets to promote heat loss, decrease physical activity, that increases oxygen demand. I have the next part.
You can also do cold compresses on the armpits and the groin and the back of the neck. I know it's not mentioned in the book, but that's also a thing.
Yeah.
My son's sitting here eating in case you hear him.
Okay.
Hey, we accept children's sounds here. So the next one that says summarize the physiological changes associated with a fever. From the book, it said warm, flushed skin, increased pulse, involuntary muscle contractions, rigors, sweating, and night sweat.
You also you could also consider that, because that was one of the questions she asked us, was if your temperature goes up, vasodilation, because you're because I remember this was the questions. It was something, I remember what the question was. There's something about vasodilation or vasoconstriction. Which one lowers your blood pressure? And it's the vasodilation, because your blood vessels get thicker, and so the pressure against them is less because there's more space in there.
Room, yeah, I remember that you were talking about that the other day. Hey, sorry, side note. What is the date that you guys took your class notes on 29?
I don't remember.
I'll find it. Hold on. I'll tell you in a minute.
I didn't find it, my notes that I took initially, and I don't see it.
Okay. Excuse me. I'm looking at the simple syllabus. Hold on. Oh, come on. Load.
I found digital removal of fecal implant.
Oh, I found chapter 28.
Chapter 29 was the go back. Chapter 29 was in the beginning, so it was 8:22, 8:29, 22.
Okay. Crazy. Doesn't that seem so long ago?
Like years ago.
I know. Apparently the semester went by really fast, but I feel like it's dragged. I do just wish we could have gotten through that the other thing, we shouldn't have the hour and a half delay, so we could have gotten through that one test faster, and then we would have had like 2 weeks of not class, because we could have had 21 and 26 together. I took notes on 9/12.
Okay, I found my book.
So the physiological changes, I don't know why, but I started like filling these out like on Sunday. I had something like way different.
For a fever?
I mean, I had like the body's chemical reaction increases or whatnot. Should we be looking for like the night sweats and whatnot, like you guys said, instead of
This just said, the thing says the physiological changes, and that's just what the heading said on the book, said physiological changes with a fever. So I just wrote that stuff down.
Do you know what page that is? I think I was just like pulling stuff out, like what I thought. I have the online version. I don't know if that helps.
I have the online version too. Hang on.
Mommy?
I don't know how it went.
Do I have to eat out of it?
I guess eat as much as you want. Okay. Anyways, sorry. Yeah, fine. I don't know why I put all this. Like,
Keep
Feeling really close to it.
So
because I
Unfortunately,
put like weird stuff, like fever fights viral infections and natural. I don't know.
it's not wrong.
I mean, it's not wrong,
Yeah.
but I don't know if that's what she's looking for because
Okay.
it just says physiological. So that's just the body.
Yeah, I don't know what I was looking at or how I got this, but somehow I got this.
I'm sorry, Janelda, what did you put for the physiological changes of the body during fever?
Hold on, I'm trying to find it in the book. I swear to gosh, it came from this book.
I know, I was trying to like scroll through too.
Okay, hold on. Let me just do a search really quick. I
Okay,
have.
I was just looking at that too, and I don't.
Oh, I have it.
I have, it looks like age, hormone level, circadian rhythm, stress, and environment.
That what
Wait,
that's not physiological changes. That can affect.
it's factors.
Yeah, those are factors, not changes. So I think I don't know. I just wrote. So those things can affect your body temperature, but it's the question is, I'm understanding it is what happens to your body when you have a fever. It's how I'm understanding it, and it's sweating, it's sweating, you're flushed, you get red, your pulse goes up.
That is my question.
You get muscle spasm, you might get twitches in there.
What happens to your blood pressure? It goes down, right?
Yes, because your blood vessels dilate and there's more room, so they press less.
You said sweating, flush, rapid heart rate. Sorry, what else?
I put vasodilation instead of flush, so I remember. And then increased pulse and decreased BP.
Thank you.
That should about cover that.
In my mind. I don't know if I found it in the book.
Where's my good pen? Ouch.
Oh, good pen.
Okay, so nursing measures that promote heat loss. I'm sorry, I'm backtracking.
You're fine.
We like removing clothing and bedding.
Shivering will happen too, and you want to encourage that.
And when is that? Did you say?
But doesn't increase?
Oh, are you trying to say heat loss? Okay, and I read the wrong thing. So heat loss. So that promote heat loss. Yeah. So taking off layers, the cooling blanket, ice packs to the armpits and the groin area. Lukewarm water. Also, I don't know if that's mentioned in the book or not, but like tepid water, lukewarm water. Just letting the skin radiate as much heat off it as possible.
And then reduce physical activity, right?
And stay still.
And did you put increase like drinking beverages like water, Gatorade, whatever?
I did not do any of that.
I remember because I just on Tuesday night I was doing the EAQs for this one, and it suggested to increase oral intake of fluids.
Mm-hmm.
Is that for the fluid loss though, or the heat loss? I mean.
To promote heat loss. Yeah.
Okay.
All right. Sorry about that, guys.
Okay.
I'm back on track. So now we're on to
Analyze a patient. So this is 13 and 14 is analyze a patient's radial and apical pulses. So they're on a scale from 1, 2, 3, and 4, which is, where's the bounding? 3 is strong and steady. 2 is what? This is chapter 40. Nope, this is chapter 20. Still chapter 29.
That's too bad.
Wait, one was what? I'm sorry.
So we're still in chapter 29. Assessment of a pulse. So there's the, oh shoot,
It's
where
the
the thing
1,
go?
2, 3, right? It doesn't go up to 4, does it?
In the book it says 4, but I mean 4 is,
Okay.
but 4 is bounding. So like 3 is good. 4 is like you just did a lot of exercise. You're really gonna feel it. Is how we remember it.
You can, like,
Here it is. Here it is. It's on page
Oh shoot.
512.
Is 3
And
is
remember,
3 normal or is 2
3 is
normal?
3 is normal. 2 is diminished. 1
No.
or no, 2 is, yeah, 2 is diminished or
Normal.
barely palpable. 1 is, how do they,
Oh wait,
God,
I
okay.
think 0 is absent and then 1 is barely palpable
Yes.
and then 2
yes.
is normal.
Yes. And then
Okay.
3 is full or strong and 4 is bounding.
Okay. Okay. Yeah, I couldn't read where my semicolons were because I had the semicolon, you know.
I couldn't read
'Cause
where
I
the book
copied
had
and
it.
pasted it from the book.
Okay. Okay. But I mean, I've been putting things as 3, like, or 3 or 2 normally, because like 3 is like, yeah, I can feel it. It's good. It's strong. 2 is like, it's there, but it's hard to feel. It's how I've been doing it. Because I don't
Okay.
think, because I don't know if, and then 1 is like weak and thready is how I've been doing it. And I haven't been corrected on it yet. So.
Oh.
I got scared because when I was doing my physical assessment, I said all the pulses were +2. And I was like, wait, did I just say they were the wrong pulses?
No. So, well, like I did, oh yeah, I really feel this, or I'm like, I can feel it, but not as well. And then like, of course, yeah. So,
So
and
remember
then,
that the difference between the apical pulse and the radial pulse is called the pulse difference. The
Mhm.
pulse deficit.
Deficit.
I thought that
That's the
was the difference between the S1 and S2.
And heavy blood loss and decreased BP or like blood injury can cause that pulse deficit.
When you've lost a lot of blood, I forget what it's called.
Was it hemorrhage?
Hemorrhaging, yeah.
Dying.
What is it?
Hemorrhaging, I think you're right.
Yeah. Dying is also correct. Okay, so the pulse deficit is the radial and apical.
Is the difference between the apical and radial. Like if your apical is 72 and your one other pulse is only 64, the difference there is your pulse deficit.
So would you would subtract them, right?
Yeah.
Okay.
And then pulse pressure, which is not on here, is systolic over diastolic.
Oh, okay, I had that mixed up then.
Subtracted. Okay, that's what I was getting them mixed up with.
Okay.
Pulse is the BP, the systolic minus the diastolic, and pulse deficit is apical pulse minus radial pulse.
Okay.
All right, let me write that down.
Similar names.
Pulse deficit is apical minus radial or radial minus apical?
On the thing it said apical minus radial.
Yeah.
Which that would make sense because apical is probably the main one because if it can't reach your limbs, it's gonna stay here.
Right. That's kind of the one that it like is
The main one.
Yeah.
So if you have heavy blood loss, it's gonna worry less about your limbs, which was probably why your pulse are gonna be lower.
Did we ever figure out, because I got this question wrong, I think, the so the S2 is, so the S2 when you listen to it, it is the it's the aortic and the, is it the, which valves are which for S1 and S2? Was it, because that was one of the questions I got wrong, was because that was one of the questions.
It's S1 be the right side of your heart and S2 be the left side of your heart because the lung is your deoxygenated blood is coming from the atrial to the
Yeah,
Vent-
S2 is aortic and pulmonic.
S2 is
S1
aortic
mitral.
and pulmonic.
I
Okay, I
got
got
that
that mixed
wrong.
up. I got it mixed up
wrong
too.
I think I had put mitral or something, aortic
Yeah.
and mitral or something.
Aortic.
Well, the
mitral.
question was asked weirdly though.
yeah, it was
It's like which
confusing.
it was like which valves closed was the thing, and I was like, I don't know. It's just it was weird.
I was overthinking.
Hmm Okay.
And
All right. So analyzing radial pulses, so you gotta know where they
All
are.
the valves flapping together. I just couldn't imagine.
was that your flappy valve, Denelda? Flappy
Yeah.
valve.
Hard to
Okay.
imagine them all flapping together.
Isn't that called Tetsy's when the baby's born when all the valves are fucked up and the blood is purple because the red and the blue are
I don't know.
Probably.
Okay. All right.
Yeah.
Analyze a patient's respiration. So you analyze the depth, the rate, lungs, and
Symmetry,
symmetry. Okay, so
exaggerated movement.
all right, so I get back to this one because I did not do so great on that. So hold on. So let me get to, nope, this is too far. Where is it? 1,
Sorry, I can hear myself.
4, 5, 15. All right, so I got the depth, the rhythm, the rate, symmetry. Okay.
kids sound so cute.
Okay. And then analyze blood pressure. So that's S1 over S2. Systolic, which are the
Oh,
Okay, you said for what, for blood pressure?
so, and then for blood pressure, it is analyze, like analyze the blood pressure. So S1, S2 sounds. So the mitral and tricuspid is S1, aorta and pulmonic is S2. And then, shut up phone. And then what I have written here is the systolic, the ventricles contract, blood goes into the aorta, and the diastolic arterial walls contract is how I have it.
Yeah.
Okay. Is there anything else?
That sounds good.
Okay. Explain factors that cause variations in SpO2 values.
Carbon monoxide poisoning.
poor circulation. Skin thick. Wait, are
Cold
they
hands,
talking
dry
about
skin,
Oh yeah. Fingernail polish.
Are they
Tobacco-
moving?
fake nails.
Yeah,
If they've had dyes recently, if they're jaundiced,
Callous skin too.
Does it
calluses.
say dark skin pigment?
Yes.
pigment.
Yes.
Yeah.
Okay. Oh, hypothermia and edema.
Yeah,
As
poor
well.
circulation.
Oh, I was like, what are we talking about those? Never mind. I need coffee.
I need coffee.
I
Okay,
don't
Nicole,
either. All right, well, she's gone. Let's all talk bad about her.
look you guys. Look you guys.
Oh, cute.
Oh.
Aw.
Nicole has only seen her when she acts like a fool.
I applaud you
Oh,
for
she's-
having all the Christmas decorations up, by the way.
What did I miss?
Look at this only acts. My dog.
Oh, hi, Eleanor Roosevelt.
It's Rigby.
Sorry, Rigby. I have Christmas up too.
Oh, I was gonna bring my Christmas tree out today, but I was like, I gotta study. So maybe after exams.
Nothing is happening for me except for exams. So I'm doing nothing until 6. Although I did get one thing. Hold on, let me show you real quick.
I did this over Thanksgiving break.
This is my grand dog. She's upset because she has her listening ears on.
Oh wow.
Oh, I love that. That's so Christmas. It reminds me of Kurt Russell.
I love Kurt Russell.
Yeah. Him and Goldie make a very cute couple.
Did you find him? I'll be right back, guys.
Okay.
Got it at the Dollar General, oddly enough.
Santa's from Dollar General?
Yeah, I got that. It's a canvas too.
You mean the thing you didn't get up for? No. Thank God it was an emergency.
I actually almost thought that we printed it.
You're almost.
Hmm?
Let's see here. But I know I got it at the Dollar General. I walked by it and I was like, I really like that Santa.
The Kurt Russell painting?
Yeah.
Oh, is that what you're talking about?
Yeah.
It came from Dollar General?
Right?
Yeah.
Are you kidding?
There were some other ones that were in there too. There was a really cute snowman one.
Oh, I love snowman. Oh, I got my snowman hand towel out today.
Nice. But right now that's the only Christmas decoration we have.
I got this at Dollar Tree about 10 years ago.
Well, it's held up well. All right, let's do fluid balance real quick, because that's all we have time for before the video ends. So fluid balance is chapter 42.
Yes, this is what I did poorly on apparently because I think it was just one question of fluid balance.
I thought it was either one or two.
Yeah.
No, he's just getting over sickness.
Choose appropriate clinical assessments using clinical judgment for fluid imbalances. So you assess there's multiples of this. There's extracellular fluid volume imbalance, there's osmolality imbalance, there's dehydration, hyponatremia, hypernatremia, so water deficit or water excess, electrolyte imbalance. So hypokalemia. This is what I gotta do. I gotta do this because I did not do good on this either. So I'm gonna write this down. So
I found this. So
yeah, I know. Show you what we do.
okay. Sorry, I just had to keep my kids.
Did you guys look at Scout's thing that she did a breakdown on?
Yeah.
yeah.
It looks like fluid balance is going to be only one question.
Yeah.
Mhm.
The one question on here of it.
Okay.
Okay, so here's what it has about fluid imbalances. I have so fluid volume deficit is okay. That the fluid volume deficit can decrease weight, increase pulse, cause postural hypotension. Oh my gosh. Okay. Create postural hypotension, thirst, restlessness. It can increase your BUN and increase your hematocrit, and then increase your urine gravity.
I'll say that wasn't what I had at all because I was like the assessment. So I had like you'd assess the daily weights, you'd assess inputs, output, assess edema, electrolytes, labs, vein distension, urinalysis,
No, I had the
kidney
other stuff,
electrolytes.
too.
Oh, okay.
Go get me a diaper. Go get me a diaper. Okay, go.
Okay.
No, I have the other stuff too. Those are other things you can look for too. thirst,
Okay.
restlessness,
Mhm.
increased.
Oh, that's good.
And
I
then
didn't
for
think about
volume-
that.
Yeah, for volume excess, like a sudden increase in weight, edema, full neck veins.
That was what I
if you
had.
yeah, see any retention. But yeah, I figured if you like saw that someone just like had like a high pulse and then they were seeming really weird and excessively thirsty, you'd be like, oh, is something going on? Oh,
Mhm.
thank you.
Well,
Right,
that's one of
give
the
me
things
the
I always ask when someone is feeling bad just at work is, have you had any water today? All right, we have less than a minute, so I'm going to end this video and then we'll start a new chat.